Hello everyone, my name is Carolina De Toma. I'm a member of the VASCERN Psychology Working Group.
My name is Anne-Mette Bredahl. I'm a clinical psychologist and I work at the Norwegian Center for Rare Diseases. I'm a chair of the VASCERN Psychology Working Group who has created this video. As clinical psychologists, we have spoken to many patients who have emphasized that it's not only what was communicated in the consultation, but equally how it was communicated. We also know that communication in a good way can be challenging for many reasons and in several ways. It can be challenging as patients differ with regard to personality, age, educational level, cultural background, and life situation. Communication is also challenging as multisystemic vascular diseases are often severe and complex, although they differ with regard to severity, prognosis, and treatment options. How the information is delivered is important, as it can affect the way the patient adjusts psychologically to the disease and to which degree he or she understands the cause of the disease and the risk factors. This can affect treatment compliance and patients' ability to best deal with their disease. The communication is crucial as it builds the basis for the next step in the care. In the consultation, the patient potentially receives difficult news, which will affect him or his future and perspectives in life.
Here are some tips that could help you as physician to deal with this kind of communication in a better way. It is always advisable that the patient brings a friend or a family member, as it might be a lot of information to take in. This is especially important if the information is serious and new to the patient. Even though clinicians often are very busy, try to set aside time when having to reveal serious news to the patient. Not just pass on information, but help the patient understand the disease and what it implies. Try to find a room where you can create a calm space where you can talk without being disturbed. Avoid phone calls during the consultation and put a "Do Not Disturb" sign on the door. Focus on the patient or the family you have the consultation with. Start the consultation with presenting yourself, the purpose of the consultation and the approximate time you have available. If you must give bad news, it can help to prepare the patient for what you're going to say, like, "As you know, we ran some tests, and now we have the result. Unfortunately, it shows that..." As a clinician, it's important that you prioritize the information, so you are sure that the patient has a chance to understand the essentials. A patient being in a stressful situation processes and comprehends information slower than the professional tend to expect. It is often a good idea to begin gently with the headline. What are the main issues? Go into details later if needed and if the patient wishes to do so. Be aware of your body language and remember to face the patient, not the computer, showing interest but also to be able to observe patient's reaction. The patient might have an emotional reaction to what you say. Try to emphasize with the patient or the family and validate their feeling, like, "I see that this is difficult for you," and that is fully understandable. A good communication is important in every consultation, but in case of rare diseases, there are some aspects that are specific. The rarity might mean that the disease is not very known to the clinician or even less to the patient. Try to find out what the patient already knows about the disease and adjust the information accordingly. Avoid using difficult medical terms. This can hinder the understanding. It is important to be clear also about issues that the clinician is unsure about and issues that need to be looked further into. Check if the patient has understood the information. Be understanding if the patient asks questions. It might be not because he did not communicate well, but because it is a lot for the patient to take in. Therefore, advisable to take small breaks. Perhaps use phrases like, "Is it clear so far?" or "Does it make sense to you?" At the end of the consultation, try to summarize what you have talked about and what the future plan strategy is. Ensure that we get more appointments with you, with your colleague, or refer them to a specialistic center in rare diseases. Reassure that you or the specialist will help them as much as possible. Also, inform them about other support options, including patient organizations. There is no perfect or easy way of communicating difficult medical information, nor there is one way that fits every patient and clinician. Good communication requires consideration. Not everything is possible in a frenetic clinical environment. But the advice that we gave you are all issues to be aware of and to aim forward. Reassure the patient that there are health professionals who can assist them and that it is possible to live a good life with a rare disease.